Hello, everyone. Jim Rohn stated, "Take care of your body. It is the only place you have to live." I resonate with him as far as the need for a human being to pursue healthy living is concerned. HIV/AIDS is probably one of the most significant health concerns since the 1970s when it was first reported. The disease was characterized by defects in cells and immunity, causing a person's resistance to diseases to diminish. The World Health Organization says that the world is yet to change its mindset as far as HIV/AIDS is concerned. The epidemic is still characterized by fear, stigma, and ignorance that has raged the world since the 1980s. I believe that most of you have read about the epidemic's effects. Sadly, there are a lot of myths surrounding HIV/AIDS, which shows down which slows down the rate of finding long-term solutions for the affected. Today, I will tell you first the myths surrounding HIV/AIDS, second, the impact of the epidemic, and third, what society needs to do to address the outbreak permanently. One of the myths about HIV/AIDS is a death sentence. People assume once a person has been diagnosed with HIV/AIDS, they can no longer live an everyday life. However, testing positive for HIV does not mean that a person cannot achieve the full potential of their life. As long as individuals have access to antiretroviral therapy, they will live everyday lives. They will also live an average lifespan if they take the medications as prescribed. According to UNAIDS, over 37.7 million people across the globe are living with HIV. Most individuals living with HIV live everyday lives, especially if they strictly adhere to their prescriptions. Another myth is that you can tell that a person has HIV/AIDS by looking at them. I have in the past people equating skinniness to being sense, most likely with HIV/AIDS. However, it is essential to note that the symptoms of HIV/AIDS may display just like any other infection. The signs will include fever and fatigue, among others. The world has made remarkable progress in managing the epidemic. A person infected with HIV, but taking antiretroviral treatment will be just as healthy as other individuals that are HIV negative. Some individuals with HIV may even appear more nutritious than those that do not live with the virus. You have probably heard people argue with HIV that HIV always leads to AIDS. HIV leads to AIDS, but this does not happen all the time. According to Raymond, 2019, AIDS is a deficiency of the immune system caused by HIV when it attacks the immune system over a long period. This results in a weakened immune system, especially when the infected fail to take the prescribed medication. Patients are always advised to begin treatment of HIV early to ensure that the virus does not weaken their immune system. A study by Jai Lee Lin and Son 2007 revealed that HIV/AIDS significantly impacts families. When an infected person fails to take the medication as prescribed, the condition graduates to a chronic illness. This causes family members to change roles to take care of the infected member. This may result in anger, guilt, and resentment, significantly when the individual contracted the disease after acting irresponsibly by engaging in unprotected sex. HIV/AIDS impairs the ability of family members to take care of children. Resources are depleted when taking care of patients and their induced poverty. Gale and Hill reveal how many individuals, families, and communities have been left devastated by HIV/AIDS. HIV has left millions of children orphaned. Their lives have been significantly affected, especially in cases where the primary caregiver suffers from the disease. Gale and Hill state that Africa is the most affected compared with other regions globally. This is probably because of poor access to care, an unstable economy, and an increasing infection rate. Engaging in unprotected sex and heterosexuality are the leading causes of HIV/AIDS infection. Infection from mother to child have contributed to the rising infection rate. Although the infection rate has significantly reduced in countries and aggressive prevention programs, the world is not yet safe from the effects of HIV/AIDS. Society will play a fundamental role in finding a solution to the pandemic is concerned. The World Health Organization, also known as WHO, encourages communities to familiarize themselves with strategies inspired by the health sector to solve the epidemic. If stakeholders in society would encourage people to pursue behaviors that reduce the risk of infection, then the epidemic will become an historical problem. Individuals must be enabled to use condoms and avoid engaging in unprotected sex. Implementing strategic plans that provide national and multi-sectoral responses to the epidemic will help reduce the infection rate. Additionally, engaging in meaningful partnership with stakeholders such as the government and health professionals will help in providing a long-term solution to the epidemic. The stakeholders in the health sector have done an excellent job in reducing the severity of the epidemic. The world has made progress, especially in protecting children with HIV/AIDS parents from contracting the disease at birth. However, more needs to be done to address the problem. I myself lost someone close to HIV/AIDS back in 2008. So I would suggest or advise that anyone or their family members all get tested or share the information by word of mouth. Encourage your family members to get tested. Even on social media platforms, share the information, get it out, and encourage those around you to be tested for you and themselves. Thank you.